Joining me now is Dr. Raj Kalsi. He's a board-certified emergency medicine physician in Illinois. Good to see you, Doctor. I keep hearing the White House continues to refer to, quote, embers of the virus and says those embers are being handled. When you look at the virus spread in the US, especially compared to other Western nations, when you look at the big picture, do you see embers being handled?
What's going on right now, Michael? And by the way, thanks for having me back. This is terrible. COVID is rapidly progressing, and we're starting to see upticks in my community as well. And that's what I'm very nervous about, because that's what I can control, my local area. These are not embers. These are surges. These are ICU capacity ridden states, and people now begging for the protection they need and the ventilators they need in a second, possibly a third wave of COVID.
You know, it's a time when I mean, they're really the country's crying out for sort of national leadership. You got the president saying, and he said the other day, the virus is harmless for 99% of people who get it. I mean, I want your thoughts, but I mean, there does seem to be only two explanations for that. Obviously, incorrect statement. Either he doesn't understand the numbers and how it works, or he's deliberately playing down the risk. How do you see it, and how dangerous is that kind of talk?
Well, think of it this way, Michael. If the most harmless form of COVID, where you have symptoms, is a cold or an illness where you're out of work for 3 to 7 days, that's still significant on the family, on the household. And that virus that individual has can spread to other members of the family and also cause a significant detriment to the family. Now, if you then advance to a moderate or more severe case of COVID, these are hospitalized patients that could be in the hospital for weeks. And when we talk about the fatality rate, the people who die from COVID, we struggle as doctors for weeks, sometimes months, to keep them alive before we actually pronounce these poor people dead, with great respect to their families and their wishes. So this is not a simple, harmless exposure to a virus like a cold.
How is it in your emergency room?
Busy, extremely busy, and here's why. People have developed a complacency, and fortuitously for us in healthcare, because we need the dollars and cents to pay for nurses and doctors to work in our industry, we were hemorrhaging money when we stopped all surgeries and stopped all elective procedures so that we could prepare for the surge. But now people are becoming very complacent and very comfortable being around COVID, and they're coming back with all of their similar ailments that they did pre-COVID, in addition to the COVID patients.
Oh, goodness me. The president was in Florida Friday, and the case numbers, as we've been reporting, are frankly alarming there, and specifically in the county he visited. Experts say we're in the first wave. The president's talking the virus down. What are the optics of him being in Florida amid this surge and really not even talking about the virus? He hardly touched on it.
You know, Michael, you know me, we've talked many times. I'm not a politician, but as a doctor, when I see somebody in leadership doing something that's contrary to science, particularly in an international pandemic, it seems to me that it would ignite the base of people that support him in all of the things that he's doing wrong. So if he's not masking, he's not social distancing, he's not worried, then all of the people that follow this gentleman will not do all the things that we're supposed to do, because that's how he's leading. And this is unfortunate for those of us who are trying to do the best that we can for America.
Yeah, it is disturbing, the complacency. I see it myself. The push to open schools, reopen those, the president even threatening to withhold education funding to states that do not do as he says. I mean, most parents would love their kids to be back in school when it restarts. But what do you make of the president basically forcing that issue no matter the state's infection rate? What is the risk of schools becoming super spreaders sites?
Well, Michael, I promise you, as the parents of a 6, 8, and 9-year-old that had to homeschool our children for 6 weeks, we were miserable. We were terrible teachers. That being said, my wife, a nurse, and me as a doc, we know the risk. We know the risk of these kids being what we call vectors, meaning I'm not as worried about the kids getting infected. I'm worried about them coming back home and exposing the people that are at risk in the household, the elderly people, the people with comorbidities, heart problems, diabetes, organ transplants, chemotherapy. That's what's going to happen. And we need to have a good plan on how we're going to mitigate children going back to school before we let this happen.
Yeah. I wanted to ask you too about, I mean, I was reading the COVID autopsies finding clotting. I think the quote was in almost every organ, according to the pathologist. And this growing evidence of lasting effects, organs, neurological as well. Our own Richard Quest wrote about that this past few days. And it really does all show how much we do not know about the virus, even for those who get it and survive. Are you worried about those ongoing issues that seem to be a thing?
Absolutely. The COVID-19 syndrome, the novel coronavirus, the illness that it causes in human beings, it causes inflammation. This fundamental concept, this fundamental disease called inflammation, it starts in the mouth, the throat, into the lungs, sometimes the stomach and the GI tract. Inflammation promotes clotting, no matter what causes it. Inflammation promotes clotting, and clotting ultimately leads to death and destruction of organs. And then these downstream consequences that we're seeing, and I'm seeing now, people with weird numbness and tingling, they can't feel their face right. They're feeling like they're in a fog, they're dizzy, and they were diagnosed with COVID 3 months ago. This is very disturbing. We know so very little because science doesn't move this fast. This thing only started for America in late January.
Yeah, it is. It's extremely worrying. I've got to leave it there. Dr. Raj Kalsi, good to see you. Appreciate your time.
Thank you, Michael. Appreciate it. Stay safe.